sort of case numbers stabilising, is it something MLHD would support, to reassess those border restrictions, maybe push the border further south so people can travel freely between, say, Albury and Wodonga?
So I think it's important to acknowledge that there still is significant number of cases both in the metropolitan areas of Victoria and also in regional Victoria around the Shepparton area. We take our advice from the Chief Health Officer of New South Wales, and together with the government they create the orders and the restrictions around what the border zone looks like. Our role really is to support people to actually work within the order and the exemption process as well. So I think it's really important from our perspective to maintain the stance that we want to keep our communities safe. The temporary border closure is extremely difficult to work around. It is impacting people, it is impacting communities and businesses. And our role is to go in there and help support people's wellbeing during this process, escalate any issues around workforce. We're working really closely with our neighbours at Albury Wodonga Health to ensure that their critical workforce can come backwards and forwards to work as well. And look, we have been working in collaboration, looking after our neighbours. For example, last week, for approximately a week, we assisted police in screening those people returning home to the ACT with that small change in the order to allow people to come through. So our nurses were there testing. They did 113 return travellers, and 4 of those actually had symptoms of COVID, and they were returned to Victoria for testing before they were allowed through. So in summary, our role is to maintain the safety of our community. There is still the risk of community transmission in regional Victoria, and we will continue to support people to be able to live under the restrictions that the order is imposing.
So just on that safety, obviously, people are undergoing a lot of mental stress. I guess that's an element of maintaining safety, to make sure that those people aren't sort of pushed towards the edge. Is that something that you lobby New South Wales Health and say, look, we're seeing this on the ground as a serious problem, we may need to relax permit systems?
Look, absolutely, we are talking with New South Wales Health and our Emergency Operations Centre about the distress that is being seen in the community, along with the Border Mayors and the Cross-Border Commissioner and Premier and Cabinet. So everybody is talking and understanding what can we do to support people in the border region during the time that the borders are temporarily closed. It is about acknowledging the impact and working around the order so that we can really help people to maintain their business, maintain connection with critical services. Any other questions?
That's everything. Thanks,
Okay.
Jill.